Hello, everyone. Welcome. Welcome to this special event. Thank you so much for being here this morning. And I am thrilled to be able to introduce this amazing event for the Black Alumni Chapter that's part of the Alumni Association. My name is Wendy Day Brown, and I work at the Alumni Association, and the Black Chapter is doing a special health and wellness, a Black perspective series, and this is their kickoff event. So thank you so much for being here. As you know, today, special about COVID-19, and it is still kind of curious out there. And I was out to a Starbucks and people were looking around, do we wear a mask? Don't we wear a mask? And looking all that. So I'm thrilled that we have the special anteater physicians to give us some special insight. So thank you so much. I want to let you know that this event is recorded so we can let other people share in the knowledge here. So make sure you accept your invitation for recording. And without further ado, I'm going to pass it on to John Elston, who is the treasurer of the Black Alumni Chapter. Thank you, John. Take it away.
Well, good morning, everyone. My name is John Elston, and on behalf of the UC Irvine Black Alumni Chapter, I want to thank you for joining us today. This is the inaugural presentation in a series entitled Health and Wellness, a Black Perspective. And a little bit about it. This series was born out of the longtime philosophy in our communities. Each generation is supposed to get better. I saw this philosophy in action as a student, and it helped myself and many others, not only while in school, but 40 years later and to this very day. The Black alumni at UC Irvine represent a gold mine of talent. This greatness and experience include a wide array of professions. So these seminars are our way of utilizing this talent pool of Black professionals as we share what we've learned in the hope that, like us, you too will get better. These seminars will cover a wide array of topics. They are shared via Zoom, and they're open to all students, alumni, friends, family, community members, and others. So we encourage everyone to come. This information is free and it's invaluable. Today, the topic is COVID-19, something that has affected all of us in one way or another over time. It is also Father's Day weekend. So I say to all the fathers here today, happy Father's Day. We thank you for being good fathers, and we hope that you have a wonderful Father's Day. But however, today is about COVID-19, and it's also about highlighting some of our alumni, and simply said, it's called Black Girl Magic, as we have some of the brightest and best women of UCI alumni that's making this happen. So before we begin, I want to say thanks to the folks that helped make this possible. To everyone online that's here this morning, again, I say thank you for joining us today. Wendy Day Brown from the Alumni Association, thank you very much. We appreciate all that you do. Thanks to the Black Alumni Chapter Board, and I see many members are in the room. We represent not only 54 years of formal education, but 48 years of representation at UC Irvine from 1971 to 2019. So for those of you that need a translation, as we call it Ebonics, we represent everything from typewriters, peachy folders, and 8-tracks to Google Docs, Stay Woke, and Instagram. But we have an awesome board, and again, I say thank you to the board for being here. Finally, our presenters today, they are 4 of UC Irvine's best. You keep us healthy, and then during the pandemic, you go next level by putting your lives on the line to save us. There are no words, but simply said, you all are an incredible group of women and an incredible profession. And we say a very special thank you to each and every last one of you. And before I introduce our hosts, I also want to say a special hello today. We have one of our administrators from UC Irvine here. And we thank you for being here. Dr. Willie Banks is the Vice Chancellor of Student Affairs. Dr. Banks, thank you for being here. And this is the alumni that we have always talked about. And again, we thank you for being here, and we hope you enjoy the presentation this morning. So our host this morning, and again, we said it was Black Girl Magic, and This brother here is surrounded by two very talented Black women. The first one is a UCI class of 2004 graduate with a BA in sociology and an MBA. She is a marketing professional, so please welcome Ms. Sandra Rosenfield. The second one is UCI class of 1995. She has a BA in political science and a master's in public administration. She is an associate director of facilities. Ladies and gentlemen, please welcome Miss Arnesia Bryant. Arnesia.
Welcome, welcome, welcome. I'd like to thank you all for coming today. I have a few housekeeping etiquette tips for us as we move throughout this process. So today we would first like to start off with a disclaimer. The UCI Black Alumni Chapter Health and Wellness Workshop has a disclaimer, and that disclaimer is, while we have sought to provide you with valuable, updated, and relevant information, the content of the UCI Black Alumni Chapter Health and Wellness Workshop is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and does not constitute a consultation with a healthcare professional. This information is intended to be informational and educational purposes only. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding the topics covered herein, or for how these matters pertain to you and or your particular medical condition, health, and well-being. So we want to say that is our disclaimer this morning. We also would like to acknowledge that this recording will be available for all of those who have registered. And for those who registered and weren't able to make it, they also will be able to see this particular recorded presentation. In addition to this, just a few housekeeping tips about Zoom. While on this particular presentation, we ask that all of your comments in the chat, place them there. There will be someone in the chat going through your comments as we go through the process. All questions, I have placed a format in the chat that says, if you have a question, please put question and then put your question. All of those questions will be forwarded to the healthcare providers today, and they will be answering those questions at the end. We thank you for your time. We look forward to seeing you. As we have mentioned, there will be ongoing health and wellness presentations that follow this one. We thank you, and remember, we're all here to serve and to grow. Zot, zot, zot. Next up, we will have Sandra.
Thanks, Arnesia, and thank you again to, I'd like to extend my thanks to everyone for joining us today. I'm really looking forward to this panel discussion and for us to go through all of the different important information that will be shared this morning. But what I would like to do is just simply point out that I think our team would be remiss if we did not point out that today is Juneteenth. And so if I may, I'd like to say just a few words with regards to that and how it sort of ties in to the conversation that we'll be having here. So as you all know, the Emancipation Proclamation that was enacted in 1863, which states that all enslaved people in the Confederate territory are declared legally free. However, many of all slaves would be immediately free. In the westernmost Confederate state of Texas, the enslaved people there were not free yet, as news traveled very, very slowly at that time. Freedom finally came on June 19th, 1865, when Union troops arrived in Galveston Bay, Texas, and announced that the 250,000 enslaved people in that state were free by executive order. This moment started an era of great hope during a time of uncertainty and struggle for the nation as a whole. Formerly enslaved people sought to reunify families, establish schools, run for political office, push legislation, and sue slaveholders for compensation. Juneteenth marks our country's second Independence Day. And, excuse me, and the historical legacy of this day shows the value of never giving up hope in uncertain times. What was once a holiday heavily observed in Texas, the celebrations later spread to other parts of the South and throughout the country, and it is now recognized as a federally observed holiday. Just like back then, we will never give up hope in uncertain times as we strive to overcome the COVID-19 pandemic. As you all know, everyone here and every part of our society has been affected in some way by this disease. In today's webinar, it is our hope that we can talk about the facts and learn how we can continue to protect ourselves and others around us. So with that said, I'd like to introduce our distinguished panel and start that conversation. So let's see here. Going to bring up that information. Sorry, everyone, lost my window. Okay. All right. So what I'd like to do first is I'm going to introduce our panel starting in alphabetical order here. So first, I'd like to introduce Dr. Calhoun Wadi. She is a UC Irvine alum with a BS degree in biological sciences, along with an MPH degree with emphasis in health services administration. And she has a medical doctorate from the USC Keck School of Medicine. She is currently the director of pediatrics at True Care and has been there for the past 26 years, where she has stated she serves the True Care community with honor. As a pediatrician, she focuses on the whole child and building a long-term relationship with the family. Her goal is to equip parents and families to provide a nurturing, healthy foundation for their unique child, addressing developmental, educational, social, and medical matters as a partnership. Her special interests include helping families with special needs and negotiating the educational system and supporting adolescents transitioning into young adulthood. Next, we have Dr. Lydia Green. Dr. Lydia Green is a board-certified family physician providing high-quality patient-centered care in the greater Los Angeles area. Arriving at UCI in 1980, she was diligent and completed her UC education with a BS in biochemistry. She completed her professional education at the Keck School of Medicine at USC. She completed her family medicine training at the Louisiana State University, Monroe. Her interests include occupational medicine, wound care. She is currently a staff physician for Concentra Medical Clinics and provides primary care services at a local community clinic. Next, we have Dr. Natalie Lee. She is a 1982 UCI graduate of the school from the School of Biological Sciences. After completing her bachelor's in science degree, she attended Howard University, where she received her medical doctorate. Dr. Lee specializes in anesthesiology through her residency training at the MLK Drew Medical Center. After many years in practice, she completed a fellowship training in anesthesia for major organ transplant at the Baylor University Hospital in Dallas, Texas. She began her practice here in Orange County in 1993 at a large multi-specialty group. She has enjoyed private practice in the US Virgin Islands, Texas, and California throughout her career. This has allowed her to have a great family lifestyle. She has served on several panels covering concerning academics, medical health topics, and medical career paths. She is also an active member of the National Medical Association. Last but certainly not least, we have Dr. Juanita Watts. and she is a family medicine physician and emeritus regional coordinator who serves as a women's health leader at Kaiser Permanente. She earned her bachelor's degree in biological sciences from UC Irvine. She was recognized as the first African-American female undergraduate to be admitted to the medical school. After she completed her medical degree at the university, she received high honors and recognition for her excellence as a student while she was there. She completed her internship and residency in family medicine at Kaiser Permanente LA Medical Center. She went on to start her practice at Kaiser West LA Inglewood Clinic. As a family medicine physician, she has been committed to creating healthier communities by focusing on chronic conditions. Dr. Watts speaks across the nation advocating for women's health. Dr. Watts has also appeared as a regular columnist in the Kaiser Permanente quarterly publication, Partners in Health. She has also written a book called Setting a New Course for Women's Health, Inspired Leaders, Dedicated Physicians, Making Lives Better. Her service and leadership to the medical community has garnered many awards, commending a tremendous commitment to health advocacy. So as you all heard, when we said we have Black Girl Magic, we really did mean it. We have some distinguished guests in our panelists today. So with that said, I am going to turn it over to Dr. Watts to start our panel discussion.
And thank you so much, Sandra, for that introduction. And to all of the attendees that are on, happy Juneteenth Day for the first time. We're celebrating. And of course, this would be from the thoughtful planning of our illustrious Black Alumni Board and Council. So I thank you. I'm Juanita Watts, and not only will I be serving as a panelist today, but I will also be serving as a moderator. And how honored I am that this inaugural session and series that the Black Alumni Council and Board has starts with one of the most important priorities for all of us, our health and dealing with the topic of COVID-19. I look forward to the upcoming series that will also feature other alumni because Irvine has a treasure of alumni in our Black graduates. So thank you for joining us. Now, as a panelist today, as you can see, we are experienced physicians that represent multiple specialties. We have all had a very intimate view of COVID-19 during this pandemic. What we saw, what we learned, and the impact that it had on our patients and the communities that we served. It impacted our colleagues, families, and everywhere you could look, you couldn't run from it. You know, I remember as a younger family practice doctor, talking with patients and family and saying, have you ever known anybody with cancer? A coworker, family member, or you heard about a case, or there was a famous person that you admired that had cancer. Well, guess what? Now, I don't ask that anymore. The question is now, do you know anybody with COVID or impacted with COVID? Was it a coworker? Was it a family member? Have you had any thoughts or questions about it? So our goal today with this esteemed panel that I am honored to serve with today with our presentation is we want to have some real talk for some real physicians that have served on the front line. Each of us had a different view because of our specialties. Each of us have had a different experience because of what we have had to learn in real time. COVID is novel. We've never seen anything like this. So we are excited to be able to have real talk with you and to answer some of your concerns. Find out what's on your mind. What are your questions or concerns that you have? Our goal is to engage in a conversation and to answer some of those questions and concerns. But before we do that, we like to share some information with you to set the platform to start the conversation. You will have the opportunity, it's already been explained, if you have questions that you hear along the way, to put those in the chat box. Our presentations, don't worry, this is not going to be like a medical conference where you sit for 30 minutes. Our presentation will be divided into 4 areas. We're going to cover the virus, the vaccine, pediatric issues, and then myths, nuts and bolts, and to explore some of those myths and a potpourri of a number of other things that don't fall under one umbrella. So to get this kicked off, you've already heard the disclosure. Just for purposes of re-emphasizing the disclosure, this presentation is intended as an informational webinar. It is illegal for us to give you individual medical advice, and in the context of our presentations, please discuss any diagnoses or treatment plans with your doctor. And we're going to get started with our theme of It's Up to You. First slide, please. Okay, thank you. And for those that are not muted, if you could please mute yourself. So we can go to the next slide, please. So as we begin to open up this discussion about COVID, let's look at some hard, cold facts. Over 600,000 people have already died from COVID. And even though we are seeing improvement with the decreased hospitalizations, deaths, and positivity, people are still dying. COVID's not the first pandemic. COVID is the fourth pandemic. The pandemic of the Spanish flu in 1918, where 675,000 people died. That was prior to having a flu shot. In the 1950s, 1954, 55, we saw the avian flu. But by that time, the flu vaccine had been introduced, and we saw a smaller number of people that succumbed from that particular flu, about 150,000. Then in 2009, we had the swine flu. I remember the swine flu because I was in full practice. I remember how scary it was, how infectious it was. And now, welcome to 2019, 2020, and meet COVID-19. Next slide, please. So what is a virus? The definition of a virus, as you can see, it's a pathogen or disease-causing agent, not considered living because a virus cannot reproduce on its own. It's got to have a host. So let's be clear. COVID-19 is not the first coronavirus that we've seen. In that category of viruses, there are about 7 viruses. Some are associated with something as common as the common cold, all right? This virus is constructed with a nucleic acid and a protein. Its claim to fame is that it can multiply only, and I mean only, within a living host, an animal, a human, a bacteria. It cannot reproduce on its own. It can copy itself and adapt. That means mutate. And as it mutates, it may gain more strength or change a little bit, but it does have the power to mutate. Next slide, please. The particular component or what causes COVID-19 or what it is caused by specifically is known as SARS-CoV-2. SARS stands for Severe Acute Respiratory Syndrome V2. Now, I got asked a question on the previous panels, what does COVID really stand for? So let me break it down to you. Let's keep it real. The CO stands for corona. As you see on this slide, the red spikes look like a crown. That's the corona. The VI stands for virus, and the D stands for disease. So COVID-19 is caused by SARS-CoV-2, member of the corona family of viruses that causes infections that can easily enter through your nose, throat, sinuses, mouth, and eyes. It's believed that it was first isolated in China, and it is named after the crown-like spikes on the surface of the cell. And guess what? It attaches to your cells as the host. You will learn more in this discussion from Dr. Green about the vaccine. Think of it this way. Some of you may be old enough and some of you may be too young, where people would knock on your door and say, Avon calling, and you would open up the door to admit them to order your products. Well, when COVID comes knocking on your door, don't answer the door. And we're going to talk about how you can protect yourself. A single-stranded RNA virus that makes copies of itself once inside your body hijacks your protein to make more virus and rapidly spread throughout your system. Next slide, please. It's coming. Okay, so there are variants. Variants means there are mutations that this can mutate and it can change. One of the original and early scientists in England began to immediately study the genome or the prescription or the makeup of the COVID-19 virus. What he was able to do was to translate all the parts that says, this is what this is made of. Turns out there are 30,000 parts or components that make up the COVID virus itself. So when we talk about mutations, and this COVID virus is very tricky, it doesn't mutate all 30,000, but it may mutate a few or in parts. And you'll learn more about how those mutations, once you have been vaccinated, can give you some protection, even though that vaccine may not have specifically been made for that variant. Currently, we are aware of 4 different types of variants. And they were originally named based on their country of origin. So the first one was the United Kingdom. Second one was South Africa. Third one was Brazil, and the last one was India. However, the World Health Organization decided to change the naming of the variants because they did not want to denigrate these countries that were being tied to and associated by naming them after the country. So they decided to change the naming to Greek alphabet. And we've seen this before. You know, every year we have tornadoes and storms, and they start every year at the letter A, and they all go down. And if we have more than that, then they go down and name them. So same thing, but this time just using the Greek alphabet. But the first variant is the alpha alphabet. It's the alpha. It originated in the United Kingdom. Second was beta, originated in South Africa. Third was gamma. It originated in Brazil. And the 5th was India, and that is called the Delta. Now, the Delta, unlike the other 3, has been the most contagious, the most transmissible. Next slide, please. And in talking about a little bit more about the Delta, because it is of a special concern to us as we are seeing the devastation that it is producing. It was not only do these variants and viruses have a Greek alphabet numbering, they also have a scientific identification. And for the Delta variants, that's B167-2. Now, right now, the Delta variant is doing some serious damage. It is currently impacting over 1/4 of all global health that we know of. It has spread all across the globe. Its main take is it's highly contagious, which means it can be transmitted very easily. It is currently responsible for 10% of all US cases and rapidly increasing and spreading. We are seeing increased cases of the Delta variant in LA County and throughout California. And what we know and what we have seen is for those individuals that have been fully vaccinated, that means of the 2-step vaccines, they have had both on board. It's been more than 2 weeks since they've had it. And we see that these people have had more protection against the Delta variant. For those that have only received one of the 2 shots, they have been less protected. And for those that have not received a vaccine at all, when that doorbell rings, think of that Avon lady saying, Avon here. That will be COVID knocking on your door, and you will not have the protection. We're also witnessing and seeing increased severity in children, and we're seeing more hospitalizations in this population. You will learn more about that from Dr. Calhoun. And the more it spreads, the more it will mutate. The more it will mutate, the more we have to be conscious when boots on the ground about how to approach this, how do we protect, how does it present differently in everyone's system. Next slide, please. So what are the symptoms of COVID and how can you spread it? Well, you know, it can spread it by breathing it, by transmission, by touching, by it being on a surface. And so it's easily spread. Some of the early symptoms that people can have, and you don't have to have all the symptoms to be concerned, are the coughing and fever, severe fatigue, headaches, muscle achiness, congestion. It can affect your GI system, causing diarrhea and vomiting. You know, because COVID can replicate so quickly and spread throughout your body, it can attack any major organ system in your body. It attacks the lungs. Often people with COVID have difficulty breathing, shortness of breath. It can affect their kidneys, leading to kidney failure. And you can have a loss of appetite. And it can have a number of other symptoms. And people would ask, well, how will I know when I need to seek help or get to the emergency? Trust me, you will know. The symptoms will be so bad that you will need to come in and to see what we can do to best treat. All right, next slide, please. Now, once you have had a COVID infection, there are some people that believe that, hey, you know, I've had the infection and I'm going to be okay because I've already had the infection, but that is not necessarily true. And so I want to talk a little bit about the long haulers. And we know that as many, as you can see from the slide, 30% of people will have some long-term symptoms or residuals. As the researchers continue to look at these symptoms from long haulers, they have already identified 84 long hauler symptoms that can affect you within weeks or months, sometimes after you may have had a COVID infection, and it can impair anything from the head all the way down to the toe. And these symptoms can be multiple symptoms. Some may be very mild, some may be more impactful on your normal daily activities and routines. I kind of have divided these up into three major areas of how those long hauler symptoms can impact. One is from a neuropsychiatric perspective. I know that I have seen many patients that have described brain fog or cognitive impairment, people that were sharp in their games that are now having difficulty focusing and doing the work that they previously did. They feel more tired and more fatigued. They have more anxiety, more depression, and almost kind of like PTSD symptoms and headaches that can linger. The second major area is a perspective of how it attacks the lungs. Patients may have persistent shortness of breath. They may have persistent dyspnea. That means that when you get up and try to exert yourself or exercise, you say, whoo, I'm so out of breath, I can't do that. Some patients, unfortunately, will also require ongoing oxygen treatment for weeks or months due to the permanent damage to their lungs from a COVID infection. And as far as the cardiac or heart system is concerned, there may be ongoing chest pain with shortness of breath. And we know that patients can also have an impact on their kidneys. Kidneys are very important for you to live and to function. And this is very important. So that can go in, and particularly in patients that already have comorbidities that impair their kidneys, like hypertension and diabetes. We've also seen that a lot of patients have developed diabetes post-COVID infection or during, and those that were already diabetic, their diabetes may be more challenging and definitely more difficult to control. So in closing, my message is, it's up to you to understand how this virus works, to do what you can do to protect yourself from getting COVID. Masks, distance, hand washing, no matter how you debate it, those three protective measures are going to be around for a long time. Be careful with close indoor gatherings. Things have opened up in the state of California, especially in Los Angeles. And the best tool for protection for yourself, your families, your loved ones, is to get the vaccine. Stay engaged and be safe. I'd now like to pass the next speaker, which would be Dr. Lydia Green, who will talk about the vaccine. Thank you.
Thank you, Dr. Watts, and thank everyone for the opportunity to speak today regarding COVID vaccinations. We've endured the last year of restrictions and limitations, and we have become successful through the use of vaccinations to begin now to resume our daily activities and go back to what seems to be normal lifestyle. However, as a PCP, as a primary care provider in my neighborhood, I have seen a multitude of things that limit people and cause them to have vaccine hesitancy. We've used vaccines and immunizations to prevent illness over many years. everything from varicella, hepatitis, measles, mumps, and rubella, routine childhood vaccinations. The technology is sound and it is longstanding. Each year, we configure seasonal influenza vaccines and we use them in the coming year and the same methodology to help get us through the influenza. This past year has astounded everyone in the fact that we developed a vaccine so fast by using a different technology, or so it seemed. They really have been using messenger RNA in research capacity for quite some time. And we are all familiar with the vector viral vaccines that we use for developing the influenza vaccination. To date, we have vaccinated in LA County 9,957,048 persons in the total county, and 5,499,000 were vaccinated. Those were vaccinated are adults, which is 61%, and 83% of senior citizens over the age of 65 have been vaccinated in the county. And that's a phenomenal number. And we will talk about some of the vaccine myths that come up that I hear about every day as I encourage everyone to get their vaccine. Some of the things that people believe are really outstanding. So we have had a large number of our fellow Angelenos County residents vaccinated, and therefore I believe and I recommend and we can stand assured that the vaccination is safe. Dr. Watts has outlined how the vaccine does cause and create our bodies to make an immune response to the virus. There are 3 vaccines currently available and 2 are on the way, which are in late stage development. You'll hear that on the news. Late phase development means they're in phase 3. There are multiple stages to vaccination approval or medication approval for use in humans. Moderna vaccine, Pfizer vaccine, and the Johnson & Johnson vaccine have all been given emergency use authorization. They will continue to monitor for vaccine-related illnesses well into many years from now, and they will follow up everyone. There has been some talk in the community that they want to push for approval now. However, the FDA is pushing back on that in that they must follow the scientific process and practice so that they can say it is approved for human use in all populations and give special recommendations. We recently seen where some medication had an adverse reaction, that was the Johnson & Johnson, and they pulled it immediately. So the process is safe, and we will continue to use that process to vet each of the medications that we are using in humans. However, the vaccines have had emergency use authorization, and we will continue to give the safe vaccine. The vaccine does not enter the nucleus of the cell, where that's where your DNA resides. It does not get in that far. It gets into the cell by either one of those mechanisms, but it does not get into the nucleus of your cell where your genetic material, your DNA resides. That is the who you are. Those proteins are outside. They're floating outside. They don't get into the body of the cell. And that way we can dispel the myth that they are targeting something that's important and will change who we are. That is not true. The vaccine does not go into the nucleus of the cell and change your DNA. That makes it safe. Some of the symptoms that you get once you get a vaccine, that is your body mounting a response to a small amount of irritant or the protein that we've given you. That causes you to maybe have a body ache, have a little bit of a fever or chill, but it is not the disease that we are giving you. We are not injecting you with a live virus. We are injecting you with some proteins, something that looks kind of like it, but it's not like it. It's as if we were to put a red marker on all of the people who were on our team. And then we put you into a big stadium with all of the other people, and we will be able to identify who is on our team. That's how we know which cells to target. And that way, when you are exposed to the COVID virus, the coronavirus, that way your body knows how to target that virus and to defeat it and discard it. Another factoid that we need to speak about, and there'll be a quiz later, is that even when we have those proteins that are in our body does an incredible job of cleaning up extra proteins that we don't need and discarding them. It breaks it down. But your immune system has memory, and we depend on the memory of our immune system to remember when we've been infected with something, so that when it comes again, it remembers it and it mounts a response. The vaccines are safe and they are effective. We want to continue our fight and our push. We've had technology and all of the information from the global community to bring us to this point and make it safe so that we could go on with our lives. It is phenomenal, the progress that we've made. And as long as we respect the science, as a good scientist that I know, is if we respect the science, we will do well. We cannot cut corners, and we do not cut corners. It is safe and safe to use. We will show a slide later on about the vaccine schedules regarding both the Pfizer vaccine, which is a 2-vaccine process, a Moderna vaccine, which is also 2 vaccines, and they're each 3 to 4 weeks apart, and the Johnson & Johnson, which is 1 shot, 1 and done. They each have their advantages, but they're equally effective. And if given to the proper population, they are effective in preventing severe hospitalization and death from the COVID vaccine. Dr. Calhoun, I'd like to pass the baton to you. Thank you.
Thank you, thank you, thank you. As she said, I'm Dr. Calhoun, I'm a pediatrician, and I'm going to mention a few numbers about COVID in children, and then talk more about the ramification of COVID and the aftermath and how it's impacting our children. I just need to move this screen over. Sorry about that. So as of last week, there have been over 4 million children who have tested positive for COVID-19 since the onset of the pandemic, representing about 14% of all COVID cases. About 14,500 were reported last week, comprising 19% of the total cases. So the case rate is getting higher in children. In terms of deaths, there's been 330 deaths in the pediatric population, comprising less than 1% of overall COVID-19 deaths. So we know that COVID is less, in general, COVID is less potent in children, but they can suffer death and disability. And there's one particular infection, the multi-system inflammatory MIS disease that has a devastating impact on children. One big repercussion of COVID-19 in the pediatric population is that the mitigation efforts basically decrease the number of children coming in for their physicals and their immunizations. Important infections like meningitis, pneumonia, chickenpox that were mentioned earlier, we're not able to vaccinate the children because of the mitigation efforts. At first, when COVID first started, basically most practices, outpatient practices, just went to a standstill, basically. And we only saw children that had to be seen, such as newborns and children under 2 to get their main vaccines. Children older than 2 were lost to follow-up. Eventually, we transitioned to telehealth as a need to screen visits. We redesigned our waiting areas, split visits between sick and well, and screened everybody entering the building. And even with our best mitigation efforts, there were families that would still come into the office with COVID symptoms or not symptoms, because we know that children often have the disease with absolutely no symptoms. So nationwide, pediatric visits remain down and the immunization rates are significantly lower. In my particular practice, our vaccination rates have decreased about 23%, and our visits are overall down about 20%. So this decrease is really significant to the point that insurers, HMOs, are providing incentives to get kids to come in for their physicals and get their immunizations. Another impact is academic performance. Children suffered with distance learning from issues with technology, lack of internet connection, Wi-Fi, crowded homes, parents who are ill-equipped to be teachers, language issues. All of these things had an impact. When I see children for well visits, this particular year, I started asking, okay, how are you doing with the distance learning? And I would say, gosh, more than half of the kids expressed difficulty. Some teenagers just absolutely shut down. And the truancy rate increased, as well as children just dropping out. Special needs students were impacted as well, because some of their services stopped, their aides, they didn't get the academic support. Now, the topic of returning to school was very heated this past spring. You had two different sides, parents wanting their kids to go back to school and teachers and their unions wanting to make sure that school was safe. In the area that I work, most of the children didn't get back into school until like March or so. But each area had their own regulations, so it was a little confusing. I imagine that when we go back to school in the fall, we'll have everybody on campus. Some universities are actually asking for the college students to have their COVID vaccination, and that's going to be a little bit controversial. We'll hear more about that as we get closer. Another impact of the COVID vaccine is on mental health. Rates of anxiety, depression, suicide attempts skyrocketed. For me, there was a huge increase in the request for referrals for behavioral health. And as such, behavioral health is just overbooked, and there's not a lot of access for children to get these services. I can recall a particular day where I had 4 children I was following up for suicide attempts in one day. And it was really overwhelming, actually, to see how much this brought out anxiety and depression. I've experienced an increased need to manage anxiety and depression on my own and prescribe medicine because the children aren't able to get into behavioral health. For teens, this COVID is impacting them a lot more because socialization is so important for them, and to not be able to connect with their classmates and friends, it has decidedly decreased their social connection. Also, use of social media has increased, and in a sense that adversely impacts anxiety and depression as well. In terms of physical health, one, I don't want to say advantage of COVID, but one impact of COVID is that because of quarantine, common childhood illnesses like regular cough and colds, ear infections, pneumonia, that decreased significantly. I think I diagnosed otitis media and ear infection once in a year. I'm not kidding. Fewer asthma exacerbations because basically these kids are not around each other sharing their viruses. So that was a positive impact. Lack of PE, restriction to home, resulted in decreased physical activity and weight gain. And that's not just the kids. A lot of people gain weight because of COVID. Children are spending much more time on their gadgets and on Zoom. And actually, we're also seeing an increase in myopia, nearsightedness, and keyboarding injuries, like carpal tunnel in teenagers. Team sports and other forms of competition were essentially halted and now have come back online. But for those athletes that, high-performing athletes, it's impacted their ability to be seen by coaches and to be recruited. And now that the athletes are getting COVID themselves, there's another roadblock because they have to be cleared to return, because we know that COVID can have an impact on the heart and cause myocarditis in athletes. So when we do the sports physicals, sometimes we have to refer to cardiology based on their symptoms. As restrictions have lifted, for example, in California on the 15th, most of the restrictions were lifted. We're modifying the mitigation efforts. We're opening up our offices and seeing more patients. The numbers are improving, but we're still not back to baseline in terms of our physicals and our immunizations. So we're doing lots of outreach to get the patients back in. And despite the vaccines, I still have a lot of parents that just don't want to step foot outside the office. And our goal is to make sure parents understand that we're making the offices as safe as we can and to decrease the exposure. So basically, COVID-19 has left an undeniable impact on the way we deliver healthcare. And we're not going to ever go back to our pre-COVID life. The delivery system will always be different. I imagine we're going to always be doing telehealth. Actually, I kind of like telehealth, but that will continue. We're going to still wear masks in the office, and we're going to give more access digitally to patients. So now I'm going to turn it over to Dr. Lee, who will wrap it all up and talk about myth busters and the nuts and bolts. Thank you.
Hello, and thank you, Dr. Calhoun. It's a wonderful presentation to all the prior presenters. Wealth of knowledge here. I hope everyone is taking it all in. And I'd like to thank you all, the BAA and UCI, for inviting me to speak on this panel. I hope I can bring you some of my experience as an anesthesiologist, kind of being on the front line of seeing the sickest of the sickest, trying to keep them alive, having surgeries, to impart in you how real this disease is. I likened it to war zone. It felt like a war zone. The hospital was not as I knew it. It shook me as a physician that I would see a disease in my lifetime like this do something that we could not do something for immediately. The unknown that was there for us as physicians as to how to practice safely was like no other time ever before. We do things routinely, we do things in order. That's kind of how you do when you do anesthesia. You follow your pattern, like I'm sure a lot of these other physicians do. But here, our norm was turned upside down, and it was turned upside down overnight. The day we decided to halt doing elective cases, closing outpatient surgery centers, only doing emergency things, really flipped the hospital all the way around. Every day, according to CDC, our guidelines were changing, and it was literally like a war zone. I can tell you that that's how I felt, and I've never served in a war zone, but that's what I thought it would feel like. I encountered so many stereotypes along the way, even from other fellow physicians, of how they understood it or how they understood one ethnic group to be more contagious than the other. If I could sit and have about an hour or two, we could really sit and chew a lot of major fallacies that I came across. I'm going to share, if I can, my screen here. Ignore my messy desktop, but I'm going to share this picture here. Now let's see, can you see just the picture or do you see everything? Can you see that? This is how we looked here on your left of the screen. That's a normal direct laryngoscopy, intubating a patient for surgery. This is how we had to convert to almost instantly. Once the CDC came out with its first set of guidelines, we literally looked like we were heading out into space. I've never worked like that before. Now, since the disease has more knowledge about it and transmission and therapeutics and vaccines, we don't quite have this huge right-sided picture where we've got these astronaut suits on, but we still have a whole regimen of garb that we have to put on for each case. We have to do each room differently. It's still not as normal as we would think, and maybe we'll never be that normal again. Maybe, like as you see in the population, we'll be a lot safer, covering up more, cleaning more, and I thought we cleaned ad nauseum in the operating room. I'm going to go over a few, and I probably don't have it as well organized as I'm going to share again some of the last guests, but let's see. Desktop. I have here, oh gosh, I can't get it out, a set of myths that are just visual that hopefully you all will be able to see. Here's one that says, thermal scanners cannot detect COVID-19. That's of course true, but of course that was a myth at one point, that thermal scanners could. Thermal scanners can tell you your body temperature, and that of course is important monitoring for that we use, hospitals use, businesses use on a daily basis, even employers, to making sure that their employees are at least on the front, not with a fever. And that's something that we all had to go through. And then there's also the myth that, I'm gonna try not to get them all big because I'm gonna keep messing it up, that 5G mobile network spreading COVID-19. Okay, we know that that's no longer true. And then that was there's the fact that steroids, dexamethasone, hydrocortisone, are recommended for severely and critically ill patients. That was the original first line after hydroxychloroquine got played down, that it was not a therapeutic that is still widely used for lots of critical care patients. And then another fact, the prolonged use of medical masks when properly worn do not cause CO2 intoxication nor oxygen deficiency. I hear that everywhere I go. People tell me we're dying because of the mask. Well, that's not true. Also, vitamins and mineral supplements. Some people thought that they cured COVID-19. So you had people taking apple cider vinegar and a swig of gin with tonic, and you name it. There were people doing lots of things like that at the beginning of the pandemic. Drinking alcohol does not protect you against COVID-19. That's one of the ones I just said. Recovery, most people who get COVID-19 recover from it. Most people who get COVID-19 have mild or moderate symptoms and can recover thanks to supportive care. Some of the prior family doctors have alluded to you here in their talk. The percentage of alcohol, I know we've all got several comments about that, but it started at, it was 60, then it was 65, then it was 70. I think for the most part, this is World Health Organization says it should at least be 60%. The biggest thing is whatever you use, it should cover all of your hands, front, back. It should be enough to make them wet, and then you should rub them for 20 to 30 seconds. That is what's recommended. And of course, still hand washing with soap. Let's see, masks while exercising. People should not wear masks when they're exercising, and masks may reduce the ability to breathe comfortably while exercising. So the World Health Organization says that it is safe not to wear masks while you're exercising, especially if you're exercising alone, not in a large group where people are breathing heavy around you. Swimming, Water or swimming does not transmit the COVID-19 virus. There will be some that think that this summer. To reduce your risk, of course, it's still hand washing and covering your cough or your sneeze, and of course, and distancing. And if you feel any symptoms like fever or cough, contacting your healthcare provider or pharmacies or even screening patients. UV light, that was another big thing. They were making us turn in our masks in the beginning because there weren't enough. We put our name on them and they would send them through some type of a UV treatment. Ultraviolet lamps should not be used to disinfect hands and other areas of your skin. They were used for solid surface items. Vaccine and COVID disease. So, do vaccines against pneumonia protect you against the new coronavirus? No. Only gives you some immunity for the particular flu virus of that season. And then we have spraying or introducing bleach or another disinfectant into your body will not protect you against COVID-19 and can be dangerous. And as we saw in our past news cycle, a few people believed that, did that, and of course suffered the consequence. Does adding pepper to your soup or other meals prevent you from COVID-19? No, it does not. Hot peppers, hot weather, cold weather, nothing prevents it. And garlic, that was another good one. Eating garlic helps prevent infection with the new coronavirus. Garlic's healthy, might help you with your blood pressure. They do have some antibacterial property, but they do not help you with COVID. And mosquitoes, do mosquitoes transmit or household flies transmit COVID vaccine? No. There's no evidence at this point that any mosquitoes or flies have been isolated with COVID. Nasal sprays. Regularly rinsing your nose with saline help prevents infection with the new coronavirus. No, that's not true, but it might help you keep your allergies down, which would keep some of your respiratory symptoms down. So you see there are a myriad of myths. There's other ones. Prior COVID infection patients don't need a vaccine. That's not true. If you've had a prior COVID infection, you do need a vaccine because your amount of antibodies that you may have produced from initial infection may not keep the same level that they know the vaccine will give you over a long period of time. The vaccine was rushed. Dr. Green pointed out to that. They called it warp speed, and it was a rush to put out an emergency vaccine, but the technique of developing the vaccine has been around for years. It's using messenger RNA, as she has alluded to, and messenger RNA, the biochemistry of it was developed for things like this, for pandemics, so that they could quickly develop or mimic copies of the invading agent, so they could introduce that messenger RNA into a host that can help them to produce antibodies to fight off the infection. Getting the vaccine will give you COVID. Well, no. Positive vaccine means you don't wear any masks or take any hand washing or 6 feet precautions. No, you're going to find in my opening up section that you're still going to be wearing some masks, even if you do have vaccines. We covered, does the vaccine get into your cell and your DNA? No, it does not. The vaccine contains controversial ingredients. I've read, other than the messenger RNA that they have isolated against the bad parts of the virus, it contains lipid or fats and sugar. Those are the only other two ingredients in the actual vaccine. I'm going to go to the certain medical conditions here. And of course, what we find that with people with chronic and severe illness, they are the more susceptible people. Severe illness, the top of that chart, obesity. Obesity played a large role in the amount of people that were infected with COVID-19. Of course, older age, 80% of COVID-19 deaths occurs. People over 65, and more than 95% of COVID-19 deaths were in older people and people older than 45. It dropped down even further for deaths. Longstanding systemic health and social inequities also gave rise to the problems with chronic disease, people that can't afford or don't have access to healthcare, people with disabilities, other medical conditions, cancer, chronic kidney disease, chronic lung disease like COPD, asthma, moderate to severe, interstitial lung disease, cystic fibrosis, pulmonary hypertension, dementia and other neurological conditions, diabetes type 1 and 2, Down syndrome, heart conditions, cardiomyopathies, hypertension, HIV infections, immunocompromised states, liver diseases, overweight and obesity, pregnancy, sickle cell disease and thalassemia, smoking, current or former, solid organ and blood stem cell transplant patients, stroke or cardiovascular disease patients, substance use disorders. We talked about children and teens. And the action that people with chronic disease need to take is preventive measures. Continue to take your medications, follow your current treatment plan, have at least a 30-day medication supply, have shelf-stable food choices so you don't have to go out a lot. Know the triggers to your disease, and when that happens, seek medical attention. Deal with your stress and coping, learn how to. Don't delay getting emergency care, which a lot of chronic patients were doing, and we were seeing a lot more strokes and heart attacks coming through the ER in late stages because they didn't want to go to the hospital, but you should. And of course, contacting your healthcare provider if you have any concerns. Going into the mental health, coping during COVID. Let's see here. Sorry about this. Okay, so public health actions such as social distancing and help reduce the spread, but it made us feel isolated and lonely. And we can and increased our stress and anxiety. So learning to cope with stress in a healthy way will make us or people and for people that we care about around us more resilient. Some of those ways of dealing with the stress of COVID is or some of the stressors that occur during COVID are feelings of fear, anger, sadness, worry, numbness or frustration, changes in appetite, difficulty concentrating, difficulty sleeping, nightmares, physical reactions like headache, body pain, stomach ache, skin rashes, worsening of chronic health condition, worsening of mental health condition, increase in tobacco, alcohol, and other substance uses. It's natural to feel stress and worry during COVID and a pandemic. But the ways that we can cope with it are taking breaks and watching or reading or listening to news stories, taking care of our bodies, deep breathing, stretch and meditation, taking time to unwind, doing activities that we enjoy, connecting with others, talking with people. Even if we start off on FaceTime or facial video communications, beginning to make connecting with your community, other people that have had their vaccinations and doing short outside activities will help you to also reacclimate and deal with the stress. And also dealing with your faith-based organization or community groups. And of course, there are several, I'm going to list a few crisis helplines at the end that you all can feel free to screenshot, or you can always tune into CDC or California.gov. They also have also some of those hotlines, and here are some of them. So we have the statewide COVID-19 hotline. This is for the state. And then we have California COVID notify hotline if you get infected or someone is. And then we have local social service information. And they have several suggestions there. And of course, 911 for emergency. I believe, let me see if I have anything else. Reopening is where I want to go to. Okay, so there are some reopening guidelines from the federal government and also from the state. Federal government reopening starts with, and this is the Biden-Harris administration, what they want states to do is to listen to the science. That's the first thing that they're asking. Not social media, not Instagram, not Facebook, not Twitter. Listen to the science. Ensure public health decisions are informed by public health professionals. Promote trust, transparency, on a common purpose and accountability in our government. This is the government speaking. Ensure all Americans have access to regular, reliable, and free testing, which they have doubled up those efforts. They want to fix personal protective equipment problems for good. So hospitals don't have to reuse their N95s to keep the first line responders safe, or other institutions. Provide clear, consistent, evidence-based guidance for how communities should navigate the pandemic, and the resources for schools, small business, families, and families to make it through. It isn't about the politics, they say, it's about saving lives. They want also to protect older Americans and others at high risk. And they have several things in, you can get that off of the White House website. And rebuild and expand defenses to protect, prevent, and mitigate pandemic threats, including those coming from China. They want to implement mask mandates nationwide by working with governors and mayors, and by asking the American people to do what they do best, step up in a time of crisis. Governor Newsom has put together some also safety reopening of California. On June 15th, as you know, this year, the governor terminated the executive order that put into place the stay-home order, and the blueprint for safer economy has also been put to rest. The new public order, effective June 15th, supersedes all prior health orders, limited restrictions only related to masking and mega events, as well as serving children and youth, pending an expected update to the K-12 school guidance by the Centers of the CDC and Prevention. Restrictions that ended June 15th are physical distancing, capacity limits in businesses, and the county tier system, which was the blueprint system. So continuing safety measures, do's and don'ts. Do wear your mask if you're unvaccinated, especially in crowded indoor spaces. Follow safety rules for mega events. Get tested if you're sick. Wear a mask while on public transit, even if you're vaccinated. Honor masks and distancing rules in place at private businesses. Get tested if required by your workplace. Wear a mask when you travel. Don't expect others to be ready to shake your hand or hug you. Don't lose your proof of vaccination. Think you can't get the virus or pass it on because you feel well. Don't think that way. Don't assume everyone is vaccinated. Don't assume everyone is vaccinated. Expect all COVID-19 rules elsewhere to be lifted. Travel into the US without proof. Don't travel into the US without proof of vaccination or a negative COVID test. Don't travel if you're sick. And I think this just kind of goes into more. I know for time, I'm going to not go over masking and travel. I think I've hit most of that. The schooling is still left to be put out by the CDC. Mega events, if you guys plan on any major concerts, events over 5,000 or outdoor events with 10,000 or more, includes events like conventions, concerts, sporting events, live events, fairs, festivals, theme parks, live sporting events, large races. They do have requirements. For indoor events of 5,000 or more, attendees must confirm proof of vaccination or negative COVID status in order to attend. In outdoor events with 10,000 or more, it is recommended that attendees confirm proof of vaccination or negative COVID-19 status in order to attend. Now, these are the requirements that the state's putting out. And of course, in workplace safety, there's no physical distancing or capacity limits for businesses and activities at work. Most businesses are required to maintain compliance with the California COVID-19 prevention. And this is the blueprint map that is retiring. So I'm gonna close all of these. Over there, thought I X'd out. Okay, so this really kind of ends the end of my, way over 5-minute presentation, but I thought those were the salient points to get across.
And thank you very much, Dr. Lee, Dr. Green, and Dr. Calhoun. And as you can see, and as we had planned, we've been getting questions in the chat box, and our illustrious panel has been answering a lot of these questions during this. So I am very pleased. I have a few more questions that have come up, and if we can unmute the panelists so that we can all jump in. We're going to ask a few more questions. But I think you all, if you take a look in the chat room, a lot of the questions have come through. A lot of the pre-selected questions that were submitted have been answered. A few more questions I think our panel can answer before we move on to Kahoot. Okay, and any of the panelists, you can jump in at any time. I thought this was a great question, did not come up. Should pregnant women who are pregnant get the virus, get the vaccine, and does the vaccine disrupt your menstrual cycle? So I know that I can jump in with a little bit of an answer, that the vaccine has been tested and used in pregnant women. And the good thing that we have learned is that when the babies, the vaccine was given during pregnancy, and when the babies were born with antibodies to COVID. That's a good thing. So there is not a contraindication that pregnant women should not. No, it would be nice if the vaccine could change your menstrual cycle, but it does. It's not wired that way, and it won't do that. Hey, my other panelists, what do you think?
Yes, it's much like when we give the pertussis or we give the tetanus vaccination, we are protecting the child from pertussis. So yes, vaccination is good in pregnancy. That is the latest guidance from ACOG and Academy of Family Practitioners. We can give the vaccine during pregnancy, much like Tdap.
Okay, next question. One of you asked, is it okay to take Motrin after getting the vaccine? You know, one of our panelists already talked about the symptoms after, I think it was you, Dr. Green, that you can feel afterwards. What's your recommendation about the Motrin?
I recommend that they can take Motrin in the appropriate doses, not the 800 in general, but maybe 400 milligrams or acetaminophen. Ibuprofen is our second choice. It does not do the briefly, yes, ibuprofen can be used after if you have symptoms. People were taking it before, which was changing how their body was responding. So you were pre-medicating and you were taking medication unnecessarily. You don't want to do that. You want to take medication when you have a reason.
Okay, and then there's another question that just popped up in the box, and it's about, is there enough information about getting pregnant and then getting the vaccine? Does it affect fertility? The vaccine, to what we know right now, does not affect fertility in men or women. So there would be no reason to postpone or delay taking the vaccine if you're considering your pregnancy. And I think, John, we have time for maybe 2 more questions before we move on to Kahoot. Is that correct? Okay, thank you very much. So let me get this in. There was an interesting question that came up about what are some of the warning signs that parents should look out for in children, recognizing that we know teens, even without the COVID, can be typically a little bit moody.
Yes, I call them meenagers, actually.
Meenagers, I like that term.
Yeah, the warning signs are the same that existed prior to COVID, the moodiness, the isolation, not wanting to participate. If you're considering it, then ask it. They need us, although they say that they don't. So it's important to continue to interact with your teens and try to help them with socialization and connections with friends and family. As a pediatrician, we screen all teens for depression and anxiety. There's something called the PHQ-9. It's an inventory, and parents are sometimes surprised to find out that their children are depressed.
I'd like to just throw in, as a family medicine doctor, my panel has changed. I used to take care of infants, and now if you don't have a driver's permit or a driver's license, then you need to see a pediatrician. But what I have noticed, and what I would encourage, if you see something, say something and do something. I have seen the increase also rise in suicides. Suicide is a permanent action for a temporary problem. And I am amazed how families are often shocked, not just with teens, but other family members when suicide occurs. So if you see something, say something. It can be a very intentional act that can happen very quickly, and you will only find out when you walk in a room and find someone has committed suicide. So don't wait. Follow your gut. Your gut will tell you every instinct you need to have to evaluate that sense that you can't quite put a finger on it, but do something, confront it, and get help. Okay, let's see, we got that. And then it wasn't a question, but there was a comment that someone put in about the disappointment in the educational system on children and the tremendous impact that this has had on our children. Can our panelists kind of respond to that? Thank you. Go ahead, Dr. Lee.
There was a wide variety of responses from schools. Some working hard, some teachers working really hard to connect with their students and follow up and make sure that they're engaging and participating, to the other extreme of, you know, just showing up for Zoom and doing what they had to do and not really interacting. And like I mentioned before, the special needs students, where they're, you know, the students aren't able to get the supportive care from teachers that they need, or assistance from aides. And so I just encourage parents to continue to advocate for their children, speak with their pediatrician or a different school advocate.
Okay, and then I think the final question that we have from looking at all of these questions, we've covered quite a bit, and thank you all for getting those questions in and getting them in so that we can offer them. I think the bottom line is that the best protection that we have is to get the vaccine. Be careful as things open up, because you don't know who has not been vaccinated, and people are going to lie. It's not a myth. They're going to lie and say that they have it and they didn't. Okay, so with that, I thank you all for staying tuned in with us. And this was a great panel discussion. And now I'm going to turn things back over to our alumni board and workers, and you're going to learn about Cahoots, and you guys got a ton of information. I would also encourage you, because this event was recorded, to share it with your family. It's a ton of information. And I am not surprised. I am complimented. I came in here with 4 pages and sheets of questions in addition to what was entered. And I can tell you that within the discussions, within the answers in the chat room, we have answered 87% of your concerns. Okay, so zot that, however you zot. Okay, Dawn, hand it back over to you. And thank you so much for this privilege. Panelists, thank you so much for your participation, and we're gonna Kahoot. Let's go.
So while
Thank
Sandra's,
you all.
go ahead.
Oh, sorry
Sandra.
about that. Go ahead, John.
So while Sandra's setting up Kahoot, I just want to say thank you and a round of applause to our panelists. You guys are phenomenal. There are no words. You guys were phenomenal. The information was invaluable, all the compliments. So I'm going to turn it over to Ms. Rosenfeld, and she is going to tell us, I think we have some gifts we're giving out. So take it away, Sandra.
Thank you, John. I was just going to say, before we wrap that up, I did see that Dr. Green wanted to say something. So I wanted to give Dr. Green a chance to speak.
Just wanted to say that there is monoclonal antibody for the treatment for those who get COVID infection or tested positive. Please speak to your primary care doctor. It would be something that you would have to engage and request. And this is a healthcare disparity, bar none. Because if you don't say that you have knowledge that you can get a monoclonal antibody, which will decrease your symptoms and slow the progression, dare I say cure it, it is an infusion that they will give you if you request or speak about it or ask about it in a knowledgeable way. And I don't find us talking about that, but the monoclonal antibody is effective in treating COVID.
And I just have one final question. I found that last question. Looking at the data from LA County, the lowest vaccination rates are in the African American and Latinx, especially for those in the 16 to 50 age group. 40% of the people in LA County have not received the vaccines, and we're still seeing some concern. So I hope that we've answered some of your questions, and for those of you that are thinking about having the shot, you will take this information in and consider getting the vaccine. Thank you. Back to you, John.
All right. So I think that's it in terms of final comments with regards to the presentation. So thank you again to all the fabulous, knowledgeable, brilliant doctors that have joined us today. So we're going to continue the fun. We are going to play Kahoot. So for some of you who are not familiar with this, the way that Kahoots work, well, before I go into the instructions, I just want to remind you all, I know we said it before in the chat and earlier, just want to remind you all, as you can see on your screen, the link is www.kahoot.it. Go to this link to get yourself ready to play the game. The way that it works is that you will go in, create a name for yourself, and we are going to ask you 10 questions, and they are all related to the content, the materials that we shared with you today during the presentation. So if you were taking notes, that's probably going to help you. So as we mentioned, we're going to have prizes, which are going to be gift cards to the top 3 players of the game. So the way the game works, you will get points every time you answer a question correctly. However, you will receive bonus points if you answer the question the fastest, if you answer it correctly the fastest. So you definitely want to get yourself ready to go. As soon as you know the answer, go ahead and tap that correct answer as soon as possible. I think Arnesia wants to share something.
Yes, Sandra, if you can give them the pin, everyone's looking for the pin.
Sure, I will go ahead and do that. So now that I've shared the instructions, I'm going to go ahead and get the game set up, and I will share the pin. I'll share the pin once that's ready.
No pressure, everybody, but make us proud. We put a lot of work in this presentation. I'm just saying, okay?
And while Sandra is setting up, again, we'd just like to say thank you all for coming out. We appreciate your time and commitment. We want to thank the panelists again because they did an outstanding job. I saw in the comments in the chat that this has been the most informative version of COVID since COVID has entered into our lives. Most informative presentation. So, and I've been on a lot and others have been on a lot. So thank you all. It means a lot to see our alumni just doing so well and making us proud. So I'm really glad that you were able to come and help us and invest in us and the knowledge that you've gained over the years. And it just shows how much our alumni are committed to excellence in the work that they do. So thank you again. Thank you so much. We couldn't ask for a more professional, grounded group.
And just so you know, we are not having the panelists and the board members compete. So we want to thank them, but we have 3 $25 gift certificates to Amazon.
Thanks for pointing that out, John. And thank you, Arnesia, for those great words. So everyone, I hope you can see the screen. I did share the pin. So we are getting ready to get started.
Let's go, let's go. Zot, zot, zot.
All right, we got our first question.
And there are 20 seconds to answer.
Mm-hmm.
You can read the question too when it comes up out loud.
That's a good point. My screen was kind of hidden. Okay. All right. So far, we got CK in the lead. Well, CK and JH90 are tied. Second question, when is COVID-19 virus most likely to be transmitted by? All right, you got 20 seconds. Okay. Okay. All right, almost all of you got it right. All right, so let's see the new leaderboard. Uh-oh, we got some changes, but JH90 is still in the lead. Next question, can I spread the infection before I have symptoms? I know we talked about this. We should all know the answer. All right. All right, who got it right? Okay, almost everyone. The answer was yes. Oh, wow. People are getting real serious. Coco's in the lead. We are trying to get pregnant soon, but worry that the vaccine can cause infertility. Should we wait to get the vaccine? I know this question was answered. So what do you guys think? Is it yes? Is it no? Go ahead and put your answers in.
Let's go. Let's go.
All right. Who got it right? Oh, everyone got it right. Nice. So we remembered, we were paying attention. No need to delay getting the vaccine. So what do we got here? All right, Coco's still in the lead. Next question. We're halfway through. Can I get COVID-19 infection from getting the COVID vaccine? I know this question came up during our discussion. Is it true? Is it false? Is it maybe? Let's get our answers in. All right, the answer was false. Let's see who's at the top. Coco's still at the top with 4719. All right, next question. After getting a COVID-19 vaccine, will I test positive for COVID-19 on a viral test? Yes, no? What do you all think? I know we asked this question during the Q&A part. What do you all think? All right. Okay, most of us got it. The answer is no. Okay, let's look at the leaderboard. Uh-oh, we got some shuffling going on, but Coco's still taking the lead. All right, next question. I had an asymptomatic case of COVID-19. Could I develop any long hauler symptoms? I think we talked about this during the discussion, right? So is it yes? Is it no? What do you all think? Let's hurry up and get our answers in so we can get bonus points if we're right. Okay, most of us got it right. The answer is yes, you can develop long hauler symptoms. All right, Coco is just really pulling in strong. All right, question 8. When do the long hauler symptoms present and how long do they last? So we got some choices here. What do we think? All right. The correct answer is all of the above. All right. So let's look at the leaderboard. Uh-oh, we got a change. Zot alum is now the leader. All right. We're getting to the end. Should I delay routine vaccinations for my child to have the COVID-19 vaccine? I know Dr. Calhoun Wadi talked about this. So do we remember the answer? Was it yes? Was it no? What do you all think? All right, let's see who's got it right. All right, everyone got this right. So no, we do not need to delay routine vaccinations. So let's look at the leaderboard. All right, Zodalum is still in the lead. Let's go. We're down to our final question. Let's finish strong. Which vaccine is currently authorized for children 12 years old and older? I know we talked about this, so what's the answer? Which of these is authorized for children 12 years old and older? All right, everyone's got it right. It's the Pfizer vaccine. Okay, So who won? All right. So we have Zod alum in the first place, ICJ in second, and Coco in third. So thank you all so much for participating. So we were hoping to get your real names in there so we know who to award the gift cards to. So if you can share in the chat who you were, and then we will work towards getting, on getting those gift cards over to you.
We need your first and last name and your email address. That's really important for Coco, Zod alum, and who was the third?
It was
ICJ.
Zod alum. I think it was ICJ or LCJ, and then Coco.
Okay.
All right.
I was playing just for fun. I was on the panel, so I think I shouldn't get a gift.
Okay. I'm glad you were able to still participate in the fun. All right, well, real quick, what I'd like to do is just point out just a few things. Sorry, I'm having technical
Can I
difficulties
just jump
here.
in while you're doing that?
Yes,
so
please,
it looks
because I'm having
like
some technical difficulties here, so please do.
perfect timing. So it looks like Monique Tinsley was one of the winners, and Ingrid Johnson was one of the winners. And then we had a panel member play for fun, but they opted out, of course. And so was Gail Brown the other member, the fourth place person?
Was JH90?
Were you JH90, Gail? No,
All right.
Gail was GGB.
So it looks like it was Julie Hurst who was
Julie
JH90.
Hurst. Okay, Julie Hurst was the third place. So it was Monique Tinsley, Ingrid Johnson, and Julie Hurst. And just a brief little tablet of information. Julie Hurst was actually like an RA for me when I first came in 1989. So that's kind of funny. So great job with all of you, and really excited to see you all participate.
Great questions. I should have got them all right, but I didn't use my test taking skills on one question and didn't notice it was all of the above. I was trying to do it too fast.
All right. Before we continue, I just want to share just a few quick things, sort of announcements before we wrap things up. Wanted to share it earlier, but I'll do it now. Okay. So as John mentioned earlier, this is our inaugural webinar in our series, which is called the Health and Wellness Series, a Black Perspective. So as you can see on the screen, we have various images just to represent the different aspects of life. So what we are trying to do is we are going to, as the series continues, we are going to have different topics covered by different experts, and they are going to be represented by our great, brilliant UCI alums. So we'll be covering different areas such as health, such as financial literacy, home ownership, parent-child relationships, education, and just a long list of different types of areas. So with that said, if you or someone you know is interested in joining us as a guest speaker in one of our future webinars, as you can see here, I have a list of some of those sample topics. If you are interested, feel free to email us, let us know, and we will send you a link to an interest form that you can fill out. Please make sure to put in as many details as possible to help us understand your level of expertise and what you can bring to our UCI alumni community. And we will contact you if we think that there's some alignment there, and we will work with you. So with that said, our next series our next webinar will be on education, and that's going to be in August. So stay tuned. We will be talking about how we can educate ourselves to build our children's future. So we'll be covering different topics as it relates to education. And just a couple of things to let you know as what we're doing here as a board. So the UC Irvine Black Alumni Chapter, we are working with a select group of students as mentors just to help them, provide them some guidance and sharing our experiences as they strive to complete their college degrees and pursue meaningful careers. So if you're interested in joining us as a mentor to some of the other students that we're working with, feel free to email us and let us know. Our email address is ucibaa@gmail.com, as you can see on the screen. And last but certainly not least, we have a great project that we're working with, sponsored by the UCI Libraries. We are working hard to capture all the great stories that have happened throughout the years since the school was founded in 1965. So if you have an amazing story that you want to share, please get in contact with us. We want to preserve it so that way current and future generations have a chance to experience that and learn from your experience. So this project is only open to UCI grads that identify as African American or Black. So if you're interested, please send us an email. And we definitely want to capture that information. So that's all that I have to share right now. But again, I thank you all for your attendance and participation.
And Sandra, a quick question. Do we have the email link? Is that the same one that was just posted? If people want to be a part of our series, where would they send their information?
They can either email us and we can email that link. What I'll also do is I will add that link to the chat in just a moment.
Thank you so much.
Is any of that on the UCI the Facebook page? Any of that what you just put up, is that on the UCI Facebook page?
With regards to the libraries project?
The whole series, lecture series, and asking for speakers.
That will be on the Facebook page as well. Yes.
Okay, so I think that's going to wrap us up for today. Again, I want to say a very special thank you to everybody that participated in it for taking the time today. We know you have things to do, but we appreciate it. And we hope you got something out of it, because this information, Dr. Watts made it very clear to me that they were going to raise the bar high, because these were four fabulous sisters. She didn't say how high, but to Lydia, to Juanita, to Chanel, and to Natalie, you guys are phenomenal. This was the best seminar I've ever seen. So thank you very much. My hat's off to you. We appreciate you. You are the best of the best. So with that, we're going to call it a day. And I think we have everything in the chat room if you need to read anything. And a few of us are going to hang around for a minute. And that's it. So everyone have a wonderful weekend, a good Father's Day, June 10th. And thank you. Be well and be safe. Have a good day.